Welcome to Raaonline. So today we are going to deal with hepatic encephalopathy topic. Okay. Introduction. Hepatic encephalopathy is a spectrum of reversible neuropsychiatric abnormalities seen in patients with liver dysfunction or portosystemic shunting. The moment we say hepatic encephalopathy, the two words which come to our mind is one is the reversible, the second one is the ammonia. Always we see patients with hepatic encephalopathy, we handle patients according to the ammonic levels. Also, it's a common practice that we send ammonia sample and based on ammonia we treat the patient, right? So today let us see what is the role of ammonia in hepatic encephalopathy. What is hepatic encephalopathy? How to classify them? How to treat them? What is the primary and secondary prophylaxis? How to prevent them also? Okay. So this definition saying that hepatic encephalopathy is a spectrum of reversible neuropsychiatric abnormalities has been put into question because there are certain pathogenesis happening inside the body where it is no more considered to be reversible. There are certain pathogenesis in the brain parenchyma which is relatively irreversible even if you treat the patient after hepatic transplantation also. Okay. So this particular word, the reversibility of the hepatic encephalopathy is now put under question, but for other standard methods, for other standard your exam practices, you can use the definition as reversible itself. Okay, but have an idea that there are some irreversible cerebral components also. Future papers will come on it and this definition might change. So hepatic encephalopathy is a spectrum of reversible neuropsychiatric abnormalities seen in patients with liver dysfunction or portosystemic shunting. So how will you classify hepatic encephalopathy? So now hepatic encephalopathy has been classified as type A, type B, type C. Type A meaning acute, type C meaning chronic. Okay, chronic means a cirrhosis basically. Type B is nothing but your shunt system, portosystemic shunt. Okay, this other most common classification called West Haven classification, which is this grade 1, 2, 3 and 4 with along this minimum. Okay. So, if your patient presents with a comatose situation with the jaundice, with clinical history suggestive of liver dysfunction, it's extremely easy for you to diagnose a patient as hepatic encephalopathy, right? So, these are called as the overt hepatic encephalopathy, where the patient might come in lethargic state, confusional state and stuff. It's very easy to identify these patients with hepatic encephalopathy. But there are some group of patients who are minimal and are grade 1, where the patient might completely look normal. But if you go for some psychometric analysis, you'll be finding some basic deficits. These are called as covert, just opposite of overt. Okay, just opposite of overt. It's called covert hepatic encephalopathy, right? So the minimal meaning no clinical manifestations, but this abnormal psychometric test, abnormal neuropsychological test. So this is called as minimal hepatic encephalopathy. That's called as MHE, small m and capital HE. Okay, grade 1 is personality changes, attention deficit, irritability, addition subtraction impairment, altered sleep rhythm. All these things can be a grade 1 thing. Most of the time these will be neglected, thinking these are all basic things which occur to basic common people also. But in a patient with hepatic history, in a liver failure history, when you find all these things, this you need to classify them as grade 1. Okay, grade 2 is lethargy, apathy, disorientation to time, obvious very frank personality changes, inappropriate behavior, dyspraxia and astrax. This will be your exam question. At what level will the astraxis come out? It is in grade 2. It starts with grade 2. Okay. In grade 3, somnolence to semi-stupor, the patient becoming more drowsy actually and responsive only to stimuli, confused, gross disorientation or any very bizarre behavior. All these things is grade 3 and stupor and coma is grade 4. Okay, this is your West Haven's classification. With respect to time course, episodic means bouts occurring more than 6 months apart, less than twice per year. That is going to be the episodic. Recurrent means within 6 months you get a second episode. That's called recurrent. Persistent means behavioral changes always present, superimposed with your hepatic encephalopathy exacerbations. So this is along with your time course. Okay. So when you're saying, you can even say it's a type A grade 2 episodic. or type C grade 3 or recurrent sort of things. So this can clearly give an idea about what exactly the patient is going through, right? And you need to also identify the precipitating causes, the infection, GI bleed, constipation, diuretic overuse, renal failure, hypovolemia, hypoxia, hypoglycemia, electrolyte disturbances, the hypokalemia, metabolic alkalosis, even hyponatremia, any sedative use, transglycers use, all these things can worsen or precipitate an hepatic encephalopathy in a more prone patient. Okay, hepatic encephalopathy prone patient.